For the first time in human history, fertility rates are falling in almost every country on Earth. Couples are trying for longer. Pregnancies are happening later. And more people are silently asking the same question. Why is it harder to conceive today? In this video, I'll explain what's happening to fertility worldwide, what affects both men and women, and the treatments that actually work based on science, not myths. If you value clear, evidence-based health explanations, consider subscribing. This channel focuses on understanding the body, not fear or blame. Globally, fertility rates have dropped by more than 50% in the last 70 years. Many countries are now below the replacement level, meaning there aren't enough births to replace the population. This isn't just a Western issue. The same trend is happening across Africa, Asia, and the Middle East. And importantly, infertility is not just a woman's issue. In medical practice, male and female factors contribute almost equally. So what is fertility, really? Fertility is the body's ability to conceive, and it depends on timing, hormones, healthy eggs, healthy sperm, and a supportive environment for the pregnancy to grow. In women, fertility is strongly linked to age and the quality of her eggs. In men, fertility depends on sperm count, their ability to move, and their DNA quality. When any part of this complex system is disrupted, conception becomes harder, even when people look perfectly healthy on the outside. So why is fertility declining? There are a few key reasons. One major factor is age. Women are having children later in life, often for very valid education, career, or financial reasons. But medically speaking, after age 35, egg quality and quantity decline more rapidly. The risk of miscarriage also increases. Time matters here, medically, not morally. Next, let's talk about male factors, which are often ignored. Male fertility has declined significantly worldwide. We're seeing lower sperm counts linked to a number of factors: obesity, smoking, and alcohol use, heat exposure from things like laptops or hot tubs, and even certain environmental chemicals. Untreated infections can also play a role. Fertility is a shared responsibility. It's never about a blame game. Lifestyle and metabolic health are also huge. Conditions like obesity, diabetes, and other hormonal imbalances can directly affect ovulation, sperm production, and the ability for an embryo to implant in the uterus. The reproductive system is deeply connected to our overall metabolic health. And finally, specific medical conditions can interfere. Things like polycystic ovary syndrome or PCOS, endometriosis, uterine fibroids, past infections, and thyroid disorders can quietly disrupt fertility, often without causing any obvious symptoms. If this explanation is helping you understand fertility better, subscribing helps you stay informed and supports more content like this. So, when should you worry? And when should you seek help? Doctors define infertility as trying to conceive for 12 months if you're under the age of 35, or for 6 months if you're over 35. Some red flags that might prompt an earlier visit to the doctor include irregular or completely absent periods, very painful periods, a history of pelvic infections, problems with erections or ejaculation, or a past history of certain surgeries or chemotherapy for either partner. Getting an early evaluation saves precious time and keeps more options on the table. Now, let's talk about what treatments actually work. For many couples, fertility can improve significantly with some foundational steps. This includes things like weight optimization, treating any underlying infections, correcting hormone imbalances, and improving sleep, nutrition, and stress management. Sometimes that's all that's needed. When lifestyle changes aren't enough, medications can help. These can be used to stimulate ovulation in women or to improve sperm production in men. Of course, this should always be done under strict medical supervision. Then we have what's called assisted reproductive technology, or ART. When needed, treatments like IUI, which is intrauterine insemination, IVF, in vitro fertilization, and ICSI, where a single sperm is injected directly into an egg, can bypass certain barriers and significantly improve the chances of conception. It's important to see these as powerful medical tools. They are not shortcuts, and they are certainly not a sign of failure. Finally, we have to talk about the emotional side. Infertility is emotionally exhausting. It can bring on feelings of guilt, isolation, pressure from family, and stigma, especially in cultures where fertility can feel like it defines a person's worth. But struggling to conceive is not a personal failure. It is a medical challenge and help exists. Please remember to be kind to yourself and your partner, and don't hesitate to seek out support groups or counseling if you're feeling overwhelmed. Fertility is declining worldwide, but understanding the reasons gives us power. Early evaluation, a sense of shared responsibility between partners, and relying on evidence-based treatments can make a real, tangible difference. Health decisions are always easier when they're based on clear understanding, not fear. Subscribe for more simple, evidence-based health education. This is Health Made Simple, and I'll see you in the next video.